Welcome, y'all. For today's video, I'd like to offer a short yoga practice exploring a movement of a pelvic tilt and tuck. So for this movement, you're going to be focusing on moving your pelvis and more or less isolating the movement of your pelvis while your legs are staying relatively still. And so this will require a movement of your pelvis like so. I'm only able to hold one leg here because I only have one hand. But this is the general movement that we're looking for through the pelvis here. Now, as you're moving your pelvis, there's going to be a little bit of corresponding movement that happens in your low back. However, we're working on stabilizing the rest of the spine and keeping the movement fairly isolated to this area of your body. This can be really helpful for improving the mapping of the pelvic area in your brain and for improving your control of movement at the hips and low back so that you have better awareness, better stability, and more varied movement patterns available around your pelvis. And that can be really helpful for those of us who have symptoms in the area of the low back or the hips. Sometimes this movement can be really helpful. So I will be sharing 3 different positions, 3 different variations. You'll notice that as we change your position and we change gravity and we change how much you need to support your body in gravity, that these movements feel quite different. You may find some easier than others. You may find some more useful than others at this point in your journey. So pay attention to what's going on for you. And then if you still have questions at the end of the video, I'd love to hear them in the comments. All right, so when people are first learning to do this movement, I love to start them lying on their backs. And having the floor or a bed or another piece of furniture underneath you can be really helpful for feeling what's going on. Also, here you don't have to hold yourself up in gravity, so that can be really helpful as you focus on learning this movement. If you step your feet too close to your body, what you'll find is your low back will get really compressed into the floor and it will become really hard to create movement around your pelvis. So we still want to feel stable and grounded and connected to the floor through the feet, but we do want enough distance between the feet and the body that you can have a little bit more of a sense of spaciousness through the low back and ability to move through the pelvis. You're going to imagine you have a marble or a small ball right in the middle of your low belly. And then you're going to tilt your pelvis so your tailbone lifts up and your pelvis and low back rock towards the floor so that that imaginary ball is going to roll into your belly button. Then you're going to roll that ball back to its starting point and maybe even take the tailbone more into the floor as you roll that ball down towards the base of your pelvis. So you're rolling your imaginary ball towards your belly button, flattening your low back, and then creating some space under your low back as you come back to your starting position or continue to roll that ball towards the base of your pelvis. So you're just going back and forth here. Now, when we first do this, a few things can start to happen. For some of us, we're going to notice that we're really moving through the head and shoulders and rocking forward and back on the ground. That often comes along with really pushing with the feet. And that isn't exactly the same as controlling and isolating the movement around the pelvis. Often, if we're a little stiffer around the low back, we'll send the whole body that way rather than having the spine move. And so you can see if you can make the movement smaller. It may even be so small as to be invisible, but find more isolation and control, start to activate more of the muscles around the pelvis to create this movement, and you may notice that you're able to be quieter through the legs and feet. We want to be moving in a range that isn't increasing pain or other symptoms. And being really gentle and curious and playful as you're exploring this movement for the first time. So next we're going to explore this movement in a tabletop or all fours if this is a position you're able to comfortably get into. Now I'm working with a knee injury, so I have some extra padding under my knees. You can feel free to add a cushion or a blanket under your knees if that's helpful. You can also change the position of the hands. You can come up on fists if necessary, and you can feel free to skip this one if this is not a position that works for you. So we're maybe familiar, many of us, with the cat and cow movement that involves a movement of your whole spine. For today, though, we're going to work just around the pelvis, trying to find that same tilt and tuck movement isolated now in the low back and the pelvis as we're in this tabletop or all fours position. So I'm seeing if I can keep my upper back and my neck the same as I find a tilt and tuck motion through my pelvis. And just noticing what happens in my arms and legs, what happens to my breathing as I explore the movement in this position. And then once I'm done, how does it feel? All right, so now let's bring this movement up to standing. I'll turn sideways so you can see what I'm doing. I have a little bit of space in between my feet. And then I'm going to come into a really mini chair pose here. Okay, so I'm bending my knees and my hip joints. Maybe a little bit of movement at my ankles. I want to feel really comfortable through all the joints of the legs. And I want to feel like I can spend some time here. And I'm not maxed out because I want to be able to move my pelvis. So keep this nice and small. From here, you can bring your hands to your hips to help feel what the pelvis is doing, or you can place your hands over your heart to help keep your upper body quiet. And then we're just going to begin a little bit of that pelvic tilt and tuck movement that you've been working on and see how that feels in this position, finding a range that feels comfortable and easy and noticing what happens as you move your pelvis. Now, if you're noticing wobbling through your feet or your legs, you can take a yoga block or another object and place that in between your legs. You don't need to squeeze it. You're just going to put it there to help give you a little bit more guidance and support. Come back into that original position and try your tilt and tuck again. Notice what happens with that yoga block in between your legs. Now you may be noticing that as we change positions, this movement feels different or becomes easier or harder in different positions. So that alone can give us lots of information about what's going on in our bodies. I hope you found this really useful, and I'd love to hear how it went.